I'm Beverly Kirk here with Dr. David Bowen, CEO of Malaria No More. And you wrote part of the newly released CSIS report on global health policy in the second Obama term, specifically about malaria. How has the fight against malaria progressed in the first Obama term?
Well, the fundamental reality of the fight against malaria is that there are millions of kids who are being protected from malaria all over Africa and across the world because of the efforts of the U.S. government. With bipartisan support, the United States has really led the fight against malaria. And the testament to that is that there are children alive, being productive, growing up, going to school, who wouldn't be but for our efforts. But all of that progress is at risk today, and the actions that we take in the next few years will have an enormous consequence as to whether we build on that success or risk losing it.
Why is it at risk?
Well, some of the major interventions that we've rolled out and helped make a reality across the world have a timestamp on them, have a best before date to them. One of the key things that the U.S. has done, and many other international partners too, has been to protect kids from the mosquitoes that carry malaria by the use of insecticide-treated bed nets. Now, these have a shelf life. The insecticide only stays active for a small number of years, and the nets themselves can get worn and torn, and they need to be replaced. So as amazing and as inspiring as the effort has been to date, we need another one to replace those nets, to provide the life-saving treatments and testing that kids need to get well when they are affected by malaria, and to provide the other kinds of interventions that will keep people safe and keep families safe.
I guess this is really, really key because the actual number of malaria deaths has dropped pretty dramatically over the past decade or so, right?
That's absolutely right. It's still the case that a child dies every minute from malaria, but that in itself is a substantial reduction from the case a few years ago, when it was a child every 30 seconds. But we can't take that progress to the bank. First of all, the fact that a child still dies every minute is an extraordinary challenge to all of us to do more. But even that progress is not assured. There could be a huge resurgence of the disease. As we've protected one cohort of children, they're more at risk from the disease because they haven't had it. So that protection needs to go on, or we're simply not saving those lives. We're delaying the moment when they're affected by the disease.
Let me ask you this. Is there a concern about the success? You've been successful and people kind of thinking, okay, we've gotten the hang of this, so we can kind of step back. But truth is, you can never step back with malaria, right?
That's absolutely right. I mean, the fact that a child is dying every minute should be a call all the time to further action. But you're right, in some areas of the world, and this is a success story, malaria, which was once essentially omnipresent, has now receded. But you can't take the conclusion from that your work is done. You still need the bed nets, you still need the surveillance, you still need the abatement measures. All of that needs to keep going. I mean, we see it with vaccine-preventable diseases. When the diseases are rampant, there's a real urgency to get the vaccination. When they recede, and we've seen this to some extent in this country, complacency sets in, and as a result, the diseases come back. It's the same thing, just on a much more massive scale with malaria. If we let our foot off the accelerator, the disease will come roaring back.
What are some of the priorities that you would recommend for the Obama administration to take in this next term?
Well, I think there are programmatic priorities, and then there are much more strategic priorities. On the strategic priority side, clearly funding is going to be important. The Global Fund the Global Fund Against AIDS, TB, and Malaria is reaching an absolutely critical point now, with a replenishment meeting coming up in September, which will sort of set the tone for what the world will do against these major killers in the next few years. On the programmatic side, there are important issues in terms of resistance to the drugs that have been so successful in treating malaria. There's a major issue with counterfeit and substandard medicines. It's just cruel to people to give them medicines that are labeled as something that will save their lives, save their kids' lives, and have them not work. It erodes confidence in the entire malaria and, in fact, global health treatment scheme. So those are some of the challenges. There are also microepidemics within the overall malaria picture. So, for example, in Southeast Asia, there's essentially a microepidemic of resistant malaria in the Mekong Delta. There are other pockets in other areas of the world, And Mark Dybul, the new head of the Global Fund, has said that we should be wary of what he calls the tyranny of averages. That is, you look at a country and you may see that its average rate of malaria or AIDS or TB is relatively low, but that hides within it some really dangerous hotspots, which, if left untreated, can grow out of control. But I would say that the overall biggest concern is that complacency and the need to keep the progress going, keep the fight going, keep the resources flowing, and that will help us solidify the progress that we've made.
All right, Dr. David Bowen, thank you so much.
Thank you very much.